He pretty much said, you'll be under for a couple of days, ICU for a couple weeks. So I expect to go home for a good while. And to go home 3 days later, I'm excited. I woke up 1 o'clock in the morning, felt like a horse kicked me in my chest, basically. Went to a hospital down the street. The doctor there ordered a CT scan. She came back with some nurses and a flight crew. So it was like, well, I guess this is it. I will make it through this one, because with my job here, we don't call a helicopter often unless it's something really, really, really bad. 10 minutes, I was in the air flying to Emory, met Dr. Leschnauer. He pretty much gave me the rundown of what's gonna happen.
He had a tear in his aorta, right where it comes out of the heart, and that's a lethal condition. It can decrease blood flow to many other organs in the body. It sounds cliche that every second counts, but it's true. The sooner you restore the blood flow to all the organs, the better it is. From the time I received his call to the time we were entering the operating room was 68 minutes, which is lightning fast and really a tribute to our whole system. Here at Emory, one of the surgical techniques we use to manage blood flow to the brain, we have studied that and done extensive research, and that technique and data gives us the confidence that we can perform these operations and get great outcomes.
This looks good. It's healing well, both this incision and then your shoulder incision there. You are day 3 from your emergent type A dissection. You're doing fantastic.
I don't think I would have been able to get out that amount of time without the support of the staff. Thankfully, everybody did their job, and I'm still here. Once you go through something like this, you realize I want to do everything I can to live life to the fullest, especially when people are saying you're really not supposed to be here. I'm here for a reason now.
I'm gonna let you go home today. It's been a pleasure taking care of you, and it doesn't end here.
I know that as we see him in the future, if he ever needs anything, we're here to treat him.
Charlie really cares, and he's become a big part of my life at this point.